I am Dr. Rajiv Sethi, Senior Interventional Cardiologist at the Aditya Birla Memorial Hospital, and I'll be talking to you today about heart failure. Now, heart failure is a global disease with more than 60 million people all over the world suffering from heart failure. It is very important to diagnose heart failure very early in its stages because now we have good medical treatment for the treatment of patients with heart failure, which not only helps to improve symptoms but also allows our patients to live longer and to have a better quality of life. Now, who are the patients who are prone to develop heart failure? These are usually patients who have high blood pressure, patients who are suffering from diabetes mellitus, patients who have ischemic heart disease, that is, patients who have undergone angioplasty, bypass operation, or have suffered a heart attack. These are the people who should be careful about, and they are the people who need to take a lot of precautions in order to prevent the development of heart failure. Now, how do we diagnose heart failure, and what are the symptoms that a common man should be aware of in patients with heart failure? Now, usually a person who is affected with heart failure will complain of shortness of breath or breathlessness on minimal exertion. He will say that while walking a few steps, he feels breathless. He may also complain of breathlessness on lying down. And maybe once or twice in the night, he may be getting up from sleep because of breathlessness. Most of these patients also complain of easy fatigability or tiredness on minimal exertion. They may have swelling of the feet. They may have bloating of the stomach, and they may have swelling of the neck veins. It is very important that once you develop these symptoms, you approach your nearby physician, who will then ask you to undergo an echocardiogram or some blood tests by which you will be able to diagnose heart failure. And once you diagnose heart failure, nowadays we have good medical treatment in the form of very effective medicines by which you can prevent the further progression of the disease, as well as you can prevent the complications, improve the survival, and so many of our patients are nowadays living longer and having a better quality of life with these new medications.